Welcome to med-surg Moments, the AMSN podcast. This podcast is an engaging look at the lives of and surrounding medical surgical nurses. We're proud med-surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey. In our nation's capital, decisions are continually being made by politicians and regulators, which impact our profession and our patients. Though we may not view ourselves as legislative advocates, the reality is, unless we step forward to make our voices heard, these decisions will be made without our interests being considered. Do you want politicians deciding what's best for nurses? The good news is there are plenty of opportunities through AMSN and other nursing organizations to get involved. One example is the Nursing Washington Internship grant offered each year by the Nursing Organization Alliance. We're so excited to have with us today someone here to talk about the Nursing Washington Internship and to share his own experience is Theo Urbano. Theo, welcome to med-surg Moments.
Thanks so much, Parker. I'm glad to be here.
We're so excited to have you with us today, and I'm super interested in how to get more involved in nursing advocacy. So why don't we start with you? Can you share with us your nursing story and journey?
I've been a nurse going on 11 years. As of 2011, I got into nursing because my parents kind of told me to do so. They kind of lucked out because I ended up falling in love with the profession. So it was a gamble, but it worked out for me. I've been on active duty service since starting my nursing career. The Air Force has sent me to various places around the world, starting on medical telemetry at Keesler Air Force Base, Mississippi, followed by an assignment to Osan Air Base in Korea. And then from there, I went to Spangdahlem Air Base, Germany, where I did some outpatient nursing. And then now I'm currently assigned to the Defense Health Agency in Falls Church, Virginia. So it's been a very busy, very exciting experience so far. And so we'll see where the Air Force sends me next.
Thank you for sharing your nursing journey with us. It's always interesting to hear how people got into nursing and what they've done. So you've definitely done some cool things. Did you always have an interest in advocacy? Was there a defining moment you decided you needed to get involved?
Truthfully, no. I hadn't really been aware about being an advocate. You kind of learn about being a patient advocate, but from the legislative side, I didn't even know where to begin with that. So it wasn't until I started getting into my graduate studies to be an adult gerontology clinical nurse specialist when we started talking about the role of the CNS and how, as a result of state laws and how legislators define the State Nurse Practice Acts, that's when I realized, whoa. How is it that people that don't even work in healthcare make decisions for healthcare providers? Attending NIWI, we learned that not many nurses are part of Congress. And so it's just interesting that we have all these other kinds of representatives and senators that make laws or policies that affects nursing, and they don't even have that experience. So I would say graduate school is what really started piquing my interest in this. And so at that point, I realized, holy cow, we have to create more access, expand access to care. And I'm pretty sure in the civilian healthcare system, that is no different. And so why not have clinical nurse specialists, for example, open up access, take some of the routine things from the other providers so that they can focus on other things. And so in order to do that, we need to have the state boards of nursing allow us to do that, right? And so that requires legislation and policy. So that's when I realized we need to educate our legislators so that we can practice in our full scope of practice.
You brought up a lot of good points. I don't think people really realize the connection nurses have with legislation and influencing policies that influence our healthcare. Were you already involved in legislative advocacy, or was that like your introduction to it?
Sadly, I have to admit that NIWI was my introduction to legislative advocacy. From that experience, it kind of exploded this passion for legislative advocacy because as we learned and as I am going through my studies, I realized it doesn't matter how much evidence or how much passion one has as a CNS or as a nurse practitioner or as a nurse in general. We are totally trained. We're definitely competent to do these things, but without having that authorization, the authority the legality to practice at that level, it doesn't really matter.
So you've already touched on the importance of nurses engaging in advocacy, like for advocating for patients, advocating for nurses. But can you get more into what that means and why it's important?
Nurses ought to engage in advocacy, whether they're at the baccalaureate level, even the associate's level, all the way to the doctoral level. That's because, in my opinion, we know our profession the most. Who better to make policies, regulations for nursing than nurses themselves? And so if there's ever something that is irritating or like that holds us back or that handcuffs us to certain scopes of practice, for example, the way you go about it is through advocacy, getting your legislator involved. And I'm not saying you need to go straight to the senator. You can start locally, getting involved through professional organizations such as AMSN. This was a great stepping stone for me to really get my feet wet, really get a good foundation on advocacy for nursing. Because prior to NIWI, I had no idea how to get involved. It was just something, I was curious about. But then if you need a roadmap, again, professional organizations are a great way to start. And then once you attend NIWI or start having some interviews with some of your representatives, you just find yourself feeling so empowered. A lot of healthcare systems are not very inclusive of nursing when it comes to decision making. Studies out there and even demographics of a health system or even a hospital will indicate that nursing services makes up a predominant proportion of the staff at a health system or in a facility, what have you, right? So why is it that we're not invited to the table or policies get passed without even considering what the nurses' inputs are? And so I think when you get involved and advocate for nursing at the legislative level, it sets the example not only at Congress, but also for the organizational level at the hospital or the health system. Like, hey, you need to involve us when it comes to creating this policy. We all want great patient outcomes, but who's going to be the executor of said policy or the deliverer of that patient care? It's going to be the nursing staff. Not to say that the physicians or any of the other ancillary services don't deliver patient care. They do. However, 24/7 and the wee hours of the night, it's going to be the nursing staff that's there that carries out those orders. It would behoove not only the organizations or the health system nationally, it would behoove everyone really to let nurses do their thing uninhibited.
Theo, I really appreciate how you are emphasizing that nurses are large stakeholders when it comes to delivering healthcare, but also being involved in legislation. Could you talk about that? And also tell us about the Nursing Washington Internship and the Nursing Organization Alliance.
The first part of your question was about just getting involved. It's so important. And I think it starts, again, organizational level, because a lot of times healthcare administrators, they have a job to do and they see a finish line, but I think they don't realize that the baton needs to be passed to nursing prior to finishing that 440 or that relay race or what have you. And I think a fix for that is for nurses to feel empowered to speak up and say, hey, I hear you have this great policy, probably want to include us nurses on this in the coordination process, because we, as the most likely the executors of said policy, if you don't involve us, this may not be feasible and you may be wasting time or it may not be actionable. And that sucks, right? So you definitely, to save your time and to make a policy sustainable after whoever the author was retires or moves on or whatever, you want to involve us. About NIWI, I'm very lucky because I didn't really have to travel too much to go attend NIWI. Like I said, I'm stationed here in Falls Church, Virginia, and I currently live in Alexandria, which so happened to be the location of where NIWI 22 occurred. I didn't know what to expect, I'll be honest. I just knew it was an internship and I would be representing the state of Florida. There was no assigned seating, so I was really intimidated because I had went by myself. And so the networking already begins. You start talking with people on your table, and then as the internship goes on, you start meeting as a state. And so Florida was pretty well represented when I attended. So you really make a lot of great friends. The networking opportunities are pretty amazing. We had people from academia, from research. There was more than just me being from the military. So there was a good mix of representation there. And, I hate to say it, I didn't even know what the Nursing Organization Alliance was, or NOAA. I quickly learned that this alliance is an alliance of all of these different professional nursing organizations to include, AMSN and many others. So it was really great to see that regardless of what flavor you are, I'm med-surg nurse, or I'm nephrology, or I'm critical care, and, nurse, I think school nursing was even in attendance. We even had one from the Cannabis Nursing Association. So it's kind of like, wow, regardless of what organization we were there representing, we were all there for the common purpose to advocate for nursing with our different asks that we were presented with. Representing the AMSN was a very humbling experience because as you meet the different people that are in your table, as well as who would be part of your state, because we were grouped together by state. And so you got to see different people from the various organizations. And so there weren't many from AMSN. So to be that voice for med-surg nursing, while all of us were advocating for nursing as a whole, it was just a very awesome experience. Because at that point, it wasn't about bragging rights about med-surg, critical care, or what have you. We were all there with a focused goal in mind.
You were explaining how everyone was coming in and immediately networking. Are you an introvert or extrovert?
Oh man, let me tell you, I am pretty introverted, contrary to popular belief. People will say, "Oh, wow, I wouldn't have known. You're such a very charismatic." It takes a lot of mental energy, So as I entered the room, I picked the table that had nobody at it, that was furthest away from the entrance, hoping nobody would sit next to me. I get kind of uncomfortable with that. But I think as time went on, you quickly realize everyone's new to advocacy as well. This is kind of the purpose of the internship itself. And so as you get your feet wet, you'll really quickly realize everyone else is too. And so you can kind of stumble together. It was definitely a judgment-free zone in that regard. So I think for those that are a little bit more introverted, coming from someone that is, I think that the design of the internship itself will help you get out of your shell, because when you think about it, the end result is getting in front of your senator or getting in front of your representative. And so you want to be somewhat assertive when you're talking with your legislators. In that 10-minute interview, you're the voice of nursing for your state or your district. So you kind of quickly, at least I noticed for myself, I quickly got over my nerves because this was my 10 minutes with my legislator. So
awesome. I think I would have been pretty nervous too. Could you tell our listeners more about the application process and what it looked like to prepare for Nurse in Washington internship?
Yes, absolutely. So I saw that AMSN, they had a call for candidates, if you will. They were looking for applicants for the NIWI grant. I had started my graduate school studies to be a CNS, and I thought, wow, the internship's actually down the street here in Alexandria. So the worst thing that can happen is no, right? And so just go for it. The worst thing that they can say is, nope, not, you weren't selected, and you can always apply the following year. So the application process was digital. On AMSN's website, you follow the prompts, you follow the links, and you have this application questions, demographical information. If you've been a member of AMSN, how many years are you currently involved in AMSN or other legislative activities, And then they ask you like what you would like to know about it. And so I think honesty is really the best way to approach any of these application questions. I genuinely wanted to know how to get involved, given that there are so many opportunities for things to improve for nursing. If it was from just in preparation for the application and NIWI itself, I didn't even realize there was an APRN license compact. We're very familiar with the nursing licensure compact, but I didn't know there was one for APRNs. And who wouldn't, if it wasn't for something like NIWI, I would never have looked it up. So, and then once you submit your application, you hope for the best and you see what happens. And I got an email and here I am. As far as preparing for NIWI, because I had zilch experience with the legislative process, I actually went to AMSN's advocacy page and I started looking up and reviewing some of the articles that they had posted just to kind of get an idea of what were the latest trends or what were the latest hot topics that were being debated or discussed at the Hill. And so I really like learning. So I actually went to our AMSN library to complete some CE activities on various legislative topics. I think there was something about like TikTok. I recall there was a CE activity on TikTok and how through COVID, nurses were using TikTok as a way to raise awareness. And it did raise awareness on some of the issues that nurses experience. And so I think that definitely helped calm a lot of anxieties for me as far as all these other interns are going to know so much more. And here I am with zero experience. And so that's kind of how I approached it. And I found it to be very helpful because one, not only did it help me prepare for NIWI, but in preparing for NIWI, I realized, oh, there's this whole section that AMSN dedicates to advocacy. So now I refer to that for any other future questions or queries that I have.
Can you tell us about the 3-day program and some of your experiences with meeting the members of Congress? Like, who did you meet and what did you talk about?
The 3-day program was jam-packed, full of different activities, didactics, presentations to really get you prepared for day 3, which was your meeting with your senator. So the first day, they kind of introduce you to the legislative process. I think if you remember that when we were kids, like high school rock or something like that, where, you know, how a bill becomes a law, it gets proposed and things like that. So we kind of got a basics, a 101 brief on how a bill becomes a law. And that was very helpful because for many of us, we are bedside nurses or we're, you know, delivering patient care, but not really understanding how some of those policies actually dictate our practice. So that was really good. The second day, we had some guest speakers from around the ANA. We also had a guest speaker, someone that was actually the legislative aide to a sitting member of Congress. So I think that put us at ease because you really don't know what to expect. The staffer that you interview with, you have no idea if they're going to be very familiar with these nursing issues or they're going to be the expert in nursing issues. So you kind of had to prepare your questions, your talking points more adequately. One of the best things about NIWI was the organizers from NOAA had a role play exercise where they would play different staffers and we would practice our interview. And so our talking points talked about increased funding for workplace development. They also talked about the Omnibus Act, as well as talking about the Nurse Corps Recognition Act. I actually met with the staffer from Senator Rubio's office, myself and 5 other interns from the state of Florida. At the time, we couldn't meet with the other Florida senator. And so we were just happy to get in front of Senator Rubio. So because the senators are, I want to assume they're more busy, and the fact that they represent the entire state versus our individual representatives, having all 6 of us Florida interns meet with Senator Rubio was more effective in trying to get all of us that experience, but also kind of group together, show force in numbers that there's multiple nurses that are advocating for these things. And so I personally met with Representative John Rutherford's office. I did that in person. I was very surprised they would let me do it in person because when I met with Senator Rubio's office, it was via telephone conference. And so when the staffer said, hey, do you want to come in person and come to our office? I said, oh, hot dang. I was totally expecting like something virtual. And that was a great experience. But some of the things that we talked about were appropriations requests for Title VIII nursing workforce development programs, the National Institute of Nursing Research, investments in the Build Back Better Act to include the Omnibus Act, and the United States Cadet Nurse Corps Service Recognition Act. I hate to say it, but before attending NIWI, I had no idea about any of these things that were currently in the works by some of our legislators. Being a veteran myself, to not even know that there was the Cadet Nurse Corps It was enacted in response to World War II and the fact that there was a nursing shortage locally. All attention was focused on the war efforts on the front lines, but there weren't enough nurses to take care of the population remaining here in the States. And so as part of this Cadet Nurse Corps, there was a program where the federal government would pay for your nursing school to serve your community in the hospitals that were approved for you to serve in. And so this act recognized those professionals, kind of giving them the same recognition that our veterans receive, because they were serving in a time of war, especially when our country asked them to. It wasn't conscription, it was all voluntary. And so if you think about World War II, that was in the 1940s, we're now in 2020s, some of these nurses are starting to die off. And so time is not on our side as far as recognizing these nurses. One of the other things I really wanted to talk about real quickly is the National Institute of Nursing Research that we were seeking funding for. A lot of times people think nurses don't do research, but no, nurses do a lot of research as well. And the thing is about why we have our own institute among the NIH is because non-nurses are going to do research on non-nursing things. So again, kind of like, who better to write policies for nurses than nurses? Who better to research nursing issues than nurses themselves? And so something that I shared with Representative Rutherford's office was at the height of COVID-19, there were some nurse-initiated orders or protocols where proning patients would improve patient outcomes and prevent intubation and transfer to the ICU. Nurses did this. Granted, there was some approval with the medical staff at the facility, but nurses looked into the research, they came up with their own protocols, and they actually implemented a process that would improve patient outcomes, especially during the time of the pandemic where not a lot of options, we were still trying to figure this thing out, right? So when you think about investing in nursing research, I always lean to that story because, yeah, we did that. And now proning is a go-to intervention when it comes to COVID patients that are not in the ICU or critical care setting. So I told that to them. And I said, if you want more good things to come from nurse researchers, fund the NINR, because like I said, we know what's important to the nursing profession. So by funding us, we'll be able to make those advances.
I love what you said about investing or making an investment. Getting involved in nursing legislation and nursing advocacy, local, state, or federal government is an investment. And I think that a lot more hospitals and organizations, nursing schools across the country could definitely benefit from making that investment into their students and nurses in all capacities. Theo, I have to say, it's been a pleasure having you. This is definitely one of my most favorite podcasts. Back in 2019, I attended a similar event where I met Congresswoman Lauren Underwood, which was a really cool experience. She's a nurse who has her master's, and she's also active in Congress, and she's from Illinois, so that was super cool. Thank you for sharing your time and expertise with us, and we wish you the best of luck in all of your endeavors, and we hope to have you on the show again sometime soon.
Yes, absolutely. It's been a pleasure being part of this. It's my first podcast. And so definitely a lot of fun. And I hope for those listeners out there, you really consider taking a chance.
We look forward to connecting with you all on our next episode of med-surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official med-surg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org. I'd also like to remind you to become a member or renew your membership at www.amsn.org. You'll receive lots of cool benefits and perks, such as discounted pricing on annual convention and continuing education.
We encourage you to help us spread the word and subscribe to the med-surg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review, tell us how we're doing, and recommend med-surg Moments wherever you get your podcasts to help us reach even more listeners. I also invite you to join the conversation by sharing your ideas and questions on AMSN's Facebook, Instagram, LinkedIn, or Twitter pages. And don't forget to add #med-surg Moments to your post. Simply enter AMSN in the search field on any of these social media platforms to connect with us.
The content within the med-surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Chelsea.
I'm Alyssa.
And I'm Caroline. And always remember, med-surg Moments is a moment in our lives, a moment in our med-surg careers that make a huge difference.